If that $400 heart medication is really stretching your budget and you're finding it's hard to pay for your prescription drugs and your rent and food, we've got great news for you. A new executive order that was just passed, and on average, we're looking at savings of $1,000 per person per year. We're going to look at how it affects Medicare, Social Security, Medi-cal. These are real savings that you're going to get, and it's already passed. Let's jump right into the video and take a look at how to take advantage of this. First, before we dive into how you're going to get these savings, let's talk about the order itself. We did a whole separate video on this where we really dive into the weeds of it, but here's just a broad sketch for you. It's called the Most Favored Nation Executive Order, and it was signed on May 12th. Essentially what it says is people in the U.S. will not have to pay more than the lowest price for the same medication than someone in another country. So if we're paying $6,000 for Humira here in the United States and Germany or Canada is paying $2,000, which is about where it's at, they can't charge us more than $2,000 here in the US. This is gigantic. By the way, those are real numbers. And we looked at Ozempic, we looked at all the big medications, the top 5 that are out there right now in our other video, but we're talking about big sums of money that you're going to be saving. So there are a lot of different impacts to this change. For one thing, it's going to hit obviously Medicare, it's going to hit Medi-cal, but it's also going to hit Social Security. And we're going to break each of those down. But for right now, just understand that we cannot be charged more than what they charge other countries. And that it even has a provision where we can buy direct from other countries. Remember the whole, we should be able to buy our drugs from Canada? This is that law. It's all in there, and it has to roll out within 30 days from when it was signed. Fantastic news. Look at the other video. Now let's break down each section. We'll go to Medicare because it's obviously going to be the big recipient here. For Medicare, we're going to talk about 2 different sections. There's core Medicare, which is usually Part B. Those are medications that are done in doctor's offices, and then even Part A, where you have medications done in a hospital setting or facility. But there are medication costs that are embedded in your Part B and your Part A. And then there's Part D, which we all know about. That's your standalone prescription drug benefit. Usually you get it with a supplement, or it can be embedded in an Advantage plan. But these are direct recipients of this executive order. It's estimated that around $66 billion will be saved per year for all of Medicare from this order. And that's conservative because they're looking at 50 to 80% reduction in medication costs. This is based on the 50. So it's a low end of that, assuming that they raise rates in other countries. The pharmaceutical companies fight back a little bit, but we're assuming the low end. So about 60 billion savings to Medicare, of which about 50 billion is for Part D. This is a huge deal. We talked about how Part D was about to get slammed in 2025, and they pumped a bunch of money into it at the end of last year to prop it up so you didn't get hit with a huge rate increase. Well, if we can save about $50 billion a year in Part D from this executive order, all of a sudden those rates come way down, and or eventually the benefits get richer. But most importantly, you're not going to see this cost shifting onto you as the person if this hits Medicare. Of course, your Part B premium that you pay each month, if you have Part B, will also reflect a drop in cost because some of Part B is also medication. All around, good news. Stay with us till the end, and we'll tell you about what the actual impact is to you as the average senior. But for the roughly 65 million people in the U.S. who are on Medicare, huge savings that will directly reflect this new executive order. Now, Social Security, what does that have to do with anything? Stick with us. Let's look at that section next. Before we jump into what it actually means for you, let's talk about another big section, Social Security. You may be thinking, why would saving on prescription costs affect Social Security costs? Well, there are a lot of different ways. One, keep in mind, this all comes from one giant fund. Don't think that Social Security has this safety bag of money and then they're paying you money you paid into it. Essentially, today's workers are paying for today's seniors' Social Security and Medicare. There is a certain fund that's supposed to run out by 2035, and we talked about that in another video. But the expenditures for our government, it's all one big thing. So if we can save across the board, that affects the viability of all plans. But there's a direct savings with Social Security as well. Keep in mind, most of us are aware every month, if we have Medicare, we're paying our Part B premium. It's around $187 on average right now. It depends on income 2 years ago, and we have a whole video on this. But that money, it's almost $2,000 a year on average. It can go higher, is going out the door. What drives the cost of that premium? Well, it's driven by cost. And there's actually a medication component built into that as well. Any medications that are done in a doctor's office, anything that's done outpatient, you know how when you go in the outpatient surgery and the Tylenol is $40, all that's underneath this general cost structure, and that directly affects the monthly premium you're paying. It's estimated that Social Security would save about $20 billion a year if we have the conservative view of this executive order, meaning we drop costs by about 50% on our medications. $20 billion a year is a lot of money. And at the end of this, we're going to tell you what that actually means for you, for your out of pocket. You don't get the full $20 billion, but there is an amount that adds up, especially over a year's time, for the average senior that is on Medicare. So we'll look at that piece towards the end. Now let's go to one more section that is directly affected, and that's Medi-cal, which is California's version of Medicaid. Same thing would apply to Medicaid in other states or federally, but Medi-cal will directly benefit from this as well. Let's go there now. All right, you may be thinking, well, I don't have Medi-cal. Why do I care about this? Well, there's about $4 billion that's estimated to be saved from this executive order for Medi-cal, just California. Not looking at the federal Medicaid program, which is going to be 10 times bigger just based on population. So $4 billion that the state is forking over, if they can drop that by $4 billion, don't assume that that doesn't impact other facets of your cost structure or taxes in California. It does. It's all one bucket of money California has to spend. $4 billion of that, whether the feds are helping or not, is going out or going to be saved from this executive order. That's a lot of money that potentially makes other services in California less expensive or richer benefits or less taxes. Now, I may be holding my breath on that last piece, but definitely that $4 billion now is not going to have to go to medication costs for the state program. So that's a big deal. Not as big as Medicare or even Social Security, but it does impact it. And for people on Medi-cal, they usually have no cost for medications. It might mean they have broader medication lists. They can get a hold of richer drug benefits. So generally, it could make it more robust for more people in California or reduce the cost for all other Californians who don't have Medi-cal. This is great news all the way around. All right, we've kind of laid out the big components we've talked about. And Part D is a big one for that Medicare section. Let's break it down for the average person on Medicare or with Social Security, what it means to you, because it's big money and it's real money and it's coming fast. Let's go there. Before you go out and spend that money burning a hole in your pocket, please like and subscribe below. We're the only ones who are bringing relevant information for California to you as it happens, fast. We're getting this out there, and it's information you can save on, you can get the best value with, you can use this information, but only if you like and subscribe, and we can continue to bring this to you quickly where you can use it right away. Let's get back to the video. So we took all the numbers that we have on a gross level for Medicare, Social Security, Part D, Medi-cal, and we broke it down by the number of members for each that we have. And the savings came out to almost $1,000 per year. So let's break that down so you can see where it's coming from. Of course, Medicare is going to be a big piece of that. And it's estimated about $25 a month savings per person for the average person who has Medicare. All right, that makes sense. Part D is a little bit bigger at just under $30, $28. And that also makes sense because Part D is all about medication. I actually think that number is going to be a little bit higher, but there's a cap and there's copays with Part D, so you're not getting the full exposure. The government definitely will. And then Social Security, they're looking at around $22. Speaking of the government getting savings, that's $22 per month per member as well. So right there, we're just around $75, $80 per month savings per person for the average individual. That's just under $1,000. Now, Medi-cal, the savings is a little bit less. It's a couple dollars per Medi-cal member. That's good for people on Medi-cal. It's good for people off of Medi-cal, as we talked about. But if you look at the numbers, we're almost at $1,000. Again, this was a conservative range at 50% savings. If you look at some of the costs for Ozempic coming down from $1,200 to $400, or Humira coming down from $6,000 to $2,000 a month, I think it's going to be a lot more. We wanted to be conservative just so we have a sense of it, but we're looking at about $1,000 savings per year per person on average. And then I think the other side of that equation with the government savings is going to be equal or even more so. Hopefully, a lot of that gets passed down to us, the individuals, but either way, there's going to be savings on both sides. And this is fantastic news. Now, there's going to be pushback on this executive order. So make your voices heard, reach out to people, your congressional leaders, your Congress people, let them know you want that savings. You want that $1,000 because they're going to get all kinds of pressure, obviously. But it's been written. They have to act within 30 days, and then we should start to see savings very quickly. Otherwise, there are ways where we can get it directly from the manufacturers or from other countries. It's fantastic news. Check out the other video where we go deep into how it works. But ultimately, it should be more money in your pocket here in California, which is what we focus on. Thank you very much for being with us. If you stuck around this long, thank you. We appreciate it. You probably have more questions. Reach out to us. There's zero cost for assistance. You can call, email, chat, or best yet, book a time and we can go through your personal situation to address any questions regarding California health insurance. Because a lot of sources out there are nationwide, and California is really unique. We need to go through the specifics of your situation in your area to find the best options. We don't push. We don't try to sell anything. We answer questions. And if you look at our Google reviews, you'll see that reflected in how we deal with this. We're happy to help. Reach out to us. And do us a big favor. If you could like and subscribe below, that's fantastic so we can keep bringing this information to California.